everyone, welcome back to our channel. I'm Dr. Ravel from City Skin Clinic, and today I'm super excited to talk to you guys about one of my all-time favorite fillers and products that we always have in our clinic, and this is Teosyal Redensity 2. It's the under eye filler to use for tear trough correction, in my opinion. I'm going to speak to you guys about it and why I just think it's incredible. Before we get going, if you're new to our channel, welcome. Please subscribe if you want to see more of our content. We're uploading content 3 times a week. If you are a returning viewer, welcome back, and it's great to have you. If you guys have any questions about under eye fillers or Teosyal Redensity 2 or any aesthetic treatments, leave a comment below. So, what is Teosyal Redensity 2? Well, before I tell you what it is, it's important to know this is a dermal filler, and it's used by us and many other reputable clinics for under eye hollows. So we use it for tear trough correction, which is filling the hollows under here, and that helps reduce the appearance of hollows, under eye circles and bags as well. If you're curious about this treatment and want to know more, we have a couple of really good, in my opinion, videos about it, and they'll be linked at the end of this video. So Teosyal Redensity 2, it's a hyaluronic acid dermal filler. What's special about it? Well, firstly, it's the only filler that's licensed for use in the under eye area, and it's been specifically designed for this purpose. It's made by Teosyal, which is a Swiss manufacturer, and they make a bunch of other really great high quality fillers. But in terms of our clinic, we use the one that we use the most often is Teosyal Redensity 2. Just as an aside, I'm also a huge fan of their RHA range, but that's for another video. So this filler, Teosyal Redensity 2, it's super special because for many reasons. So number one, I mentioned before, it's been designed and approved specifically for use in this area. Now that is so important, because we know in terms of under eye fillers, I hope if you've been following our channel for a little bit, you know it's not a one size fits all. You can't use the same filler that you would use in the jawline for the under eye hollows, or the lips, the same filler you use for the lips for there. This is not appropriate. Some places may do that, but it's not appropriate to do that. The under eye area is really special and very delicate, and it's very easy to get, even in the best hands, complications or problems there. So we want to minimize the risk of these complications and problems as much as possible, whilst at the same time giving a great result. So the thing that's special about the under eye area is firstly the skin, and you'll see this on yourselves. It's super thin. It doesn't really have fat underneath there, and it's incredibly thin, which presents 2 challenges. Number one, it means that it's really easy to see product underneath that area. So if you place a really thick filler under that area, chances are you're going to see it in the form of lumps or blobs in that area, or just just the outline of it. The other is, if you place filler too superficially in this area, you may get something called the Tinder Effect, which is where the filler appears blue. So when the light hits the skin, the filler underneath gives a blue appearance, and that's a terrible side effect. The other thing that can happen is, because this area is so thin and delicate, is you can end up, if you use a filler that attracts a lot of water, and that usually happens in thicker fillers, and you may end up with swelling under the eyes and just having bags under the eyes, which is again not a reason why people get tear trough fillers. So these are the aesthetic problems that can happen when you use the wrong filler in that area. And I'm really only talking about hyaluronic acid dermal fillers. because I think it's really inappropriate to inject any other type of filler in the face. I think hyaluronic acid dermal fillers are safe. They've been around for a long time. They're unlikely to cause allergies or adverse reactions if they're injected properly. And on top of that, they can be dissolved immediately. And that's so important when you're injecting anywhere in the face, but in particularly high-risk advanced areas. It's really important to just use the highest quality products that are appropriate for that area. So we know that it's really important to use hyaluronic acid dermal fillers in that area, and it's important to use the right consistency. So this is where Teosyal Redensity comes in. So Redensity 2 is quite a nice thin filler, so it means that it's actually it's not providing a huge amount of volume, because whilst we want to correct the under eye hollows, we don't want to end up with kind of blobs under the eyes. We want to have a nice smooth appearance. We don't want to attract too much water. We want the filler to sit there and to smoothly kind of blend between the eye area and the cheek area. So this is the other reason. So because of the thickness of this filler, or the thinness rather, and because of its elastic properties, and because it doesn't attract too much water, you can comfortably inject it, provided it's injected in the right layer, deep enough. You can actually have that smoothing out of the hollows. And that's what refreshes the eye area, but without giving rise to lumps or anything unusual, or a Tyndall appearance. The other thing that's great about this filler is it's been formulated with vitamins and antioxidants, and those help improve the quality of the skin and help gently brighten the under eye area. We don't provide tear trough correction for dark circles under the eyes where they're caused by hyperpigmentation. There are other treatments for that, but sometimes people with under eye hollows also just have a little bit of sun damage or a little bit of darkness in the area, and this helps stimulate the skin and rejuvenate this area. So it's fantastic. And you know, when you perform something that's advanced like tear trough correction, you're really only as good as obviously your skills, but also the products that you use. So if you use a product that's specifically designed for this area, that's going to address the problem, then you're much more likely to get a really good outcome. And if you are incredibly skilled, then using the best product is only going to improve on your results. So if you're the patient, I would say, you know, it's really within your rights. I encourage all of our clients to find out as much as possible about our products. You know, if you're going to any clinic or, you know, thinking of any of these treatments, it's important to understand which product they're going to use, why they're going to use that product. Do a little research about the products themselves, just so that you know, something's going into your body, so it's really important to know about it. So that's why I'm such a huge fan of Teosyal Redensity 2. From when we started to introduce tear trough fillers, from the very beginning, we've only ever used Teosyal Redensity 2 in that area. It's a beautiful filler. You can use it with a needle, you can use it with a micro cannula, which is what we often use for certain bits of the tear trough. And you know, the other thing about this filler is there's very little downtime, because there's not much in the way of swelling with it. So it's beautiful to kind of apply. And one of the other things that's great about this filler is, you know, you pretty much see 70-80% of the effect straight away just after the treatment. And then I tell people normally it takes about 2 to 4 weeks to see the rest of it. And so in our clinic, we only ever use 1 ml of filler, usually of Teosyal Redensity 2, split between both eyes as needed in the initial setting. And then if people need additional treatment, because for example they have moderate to severe under eye hollows, then they come back in about 4 to 6 weeks time and have an additional treatment, so that you're kind of allowing the filler to do its maximal work, and then if needed people come back and have some more. It's also a great filler because it lasts for something like 8 to 12 months. In some people that can be a bit less, and in some people it may even last longer than that. So it's great for use in that area. And it plays well with some of our other favorite fillers. So often people with kind of severe or even moderate to severe under eye hollows, and who also have volume loss in the cheek, they may need both cheek and tear trough fillers combined. And in that situation, remember we say the right tool for the right job. So we'll use a Teosyal Redensity 2 for the under eye area, and then we'll use something like Juvederm Ultra or Juvederm Voluma for the cheek area, and that helps restore volume and structure to the cheek and lifts up the midface. And then we smooth the under eye hollows with that. The results are beautiful when you combine them if needed. Like all of these treatments, we approach them very much as clinical treatments. You know, these are medical treatments. We go through the pros, the cons. If someone is going to benefit or we think they might not benefit, it's really important to also understand the potential risks with any treatment. And so we have a thorough kind of consultation and consent process. And that, again, helps us make sure that this is the appropriate treatment and make treatments as safe as possible. I haven't mentioned any of the kind of risks of tear trough treatment just because I've done that in another video. And really these risks, no matter what product you use, there's always a risk of them happening. But you minimize that by using high quality products. And you minimize that by going to someone who is trained and experienced in providing these treatments and who can provide adequate follow-up as well. All in all, tear trough correction in people who need it is an amazing treatment. There's so much benefit from it if it's used correctly. And to be honest, we can only ever really in our clinic use Teosyal Redensity 2 because it's such a great filler. We've had years and years of using it, and it's a fantastic filler. The results are incredible. It's really the best of the best, I would say, for the under eye area, and it's the only filler licensed for use in that area. And I always tell clients this, you know, in a world where there is only one product that is approved for use in that area, why would we use anything else? I'm not dissing other brands of filler. We use other brands of filler for other stuff and they're amazing. But personally, for myself and our doctors in the clinic, this is what I like for all of us to use. It's the only thing we use for the under eye area. I'm going to put a link below for our Teosyal Redensity 2 page, so if you want to find a bit more information about Teosyal Redensity 2, I'm also leaving a link for our tear trough correction page as well, if you want to find out a little bit more about that. If you have any questions whatsoever, please leave a comment below. It can be about Teosyal Redensity 2, tear trough correction, or anything, any aesthetics or skin problem related. If you haven't done so already, please subscribe to our channel, give this video a thumbs up. Until next time, stay beautiful.